Can these problems, this hole in the heart thing, be easily diagnosed? Assuming it's something pretty big, a big hole, or perhaps a problem with heart rhythm. Because I'm aware that there are lots of conditions that are one thing, but they are diagnosed as another.
Yes.
And there's a lot of trouble before they get to the real, and then maybe some damage has been done.
Yes, that's very true. So it is important that as far as possible, these defects are diagnosed early. Because there are a group of people where, especially in children, with ventricular septal defects, for example, where if you don't close, if the hole is sizable and you don't close it very early, usually by the age of 6 months of age, if the child gets to be a year and a half, 2 years of age, it is sometimes too late because of the development of something we don't like called pulmonary arterial hypertension. Okay. And so everybody, most of your viewers will understand high blood pressure, yes, which we diagnose in adults. Pulmonary arterial hypertension refers to blood pressure in the lungs, and the lungs developing their own form of high blood pressure, if you like. And the problem with that is once it has developed, you now can't go back and do the operation. It becomes too late. As you put it, a lot of damage has been done.
So it will now have to be a drug
correct. So you now have to manage
management.
That. Correct. And I actually have a patient who has a very large atrial septal defect who it was the opportunity to close it in childhood was missed, and so now that she's an adult, the pressure on the lungs is now very high, and she now can't have an operation to close it, and she's on medication.
And that will be for life?
And that will be for life, yes. It becomes the only way in which that can be reversed, if you like, which is something we can currently do in Nigeria, is to offer combined heart and lung transplantation.
Wow. But that's another drug-related thing. You transplant, and then there's rejection.
Correct. So
the person keeps using drugs.
That's correct.
Okay.
So that's a very complex thing. So it's very important that for the viewers watching, that if you, particularly mothers who have children getting a lot of colds all the time, you're not sure why, he's a bit breathless. Or
colds.
Colds.
I like that.
So I thought it was very important to highlight for your viewers the kinds of symptoms that one should be on the lookout for that could alert someone to the possibility that the child or even the adult may have a hole in the heart, to put it in simple terms. Things like breathlessness. So children we know like to run around and play, but if you notice that your child is possibly, when he's playing with his friends or her friends, seems to get tired a bit faster than the friends are, or doesn't seem to want to participate, there may be a problem there that needs to be investigated.
But how do you go to the doctor? You just go to the doctor. This child is breathless. And then the doctor does what? Usually, is there a fever?
No, not necessarily. There won't
okay,
be a
that's
fever.
Good. So they won't treat for malaria.
No, they shouldn't treat for malaria. No. But hopefully the doctor should do is we should examine the child. And usually there are clues on examination of the child if the doctor is alert. So things like murmurs, things like different heart sounds.
Okay.
If they now run an ECG, they may notice slight electrical abnormalities that are a clue to the fact that there is a hole in the heart. They may check oxygen levels in the child. They may notice that the oxygen levels are low, which is also another clue. These are all the things. They may run a chest X-ray. Usually the heart will be bigger than it should be if they run a chest X-ray. And then finally, the way we usually make the diagnosis definitively is to do an ultrasound of the heart called an echocardiogram. And they would need to go to a cardiologist or a pediatric cardiologist in the case of a child, or a normal adult cardiologist in the case of an adult, to get a scan done, and that usually will diagnose the hole, show what the problem is, and then they'll be able to offer them what kind of treatment needs to occur.
Can this be done in Nigeria?
Absolutely. So I have personally done 3 procedures very recently. I had a 9-year-old girl who had a hole in the heart, was sent to me. We examined her. We found that she had a hole that was suitable for closure with the device in the catheter laboratory, and we did that about a month ago. I still just saw her yesterday, and she's doing excellently well.
Do they notice the difference immediately?
Some people do, and some people it takes a little bit of a while before they notice a difference. But she hasn't noticed a big difference as yet because it's still relatively early. I also did a 46-year-old man who also had a hole in the heart. He was found to have, he was complaining of a bit of tiredness and palpitations. And he went through the same process I outlined just earlier, and we found he had a hole in the heart. He also was sent to me, and we were able to close it in the catheter laboratory with the device. Both patients were discharged. The young girl was discharged within 24 hours. The gentleman was discharged within 48 hours.
24 hours?
Yes.
1 day procedure?
Correct.
That's awesome.
Yeah.
But do you ever have problems of having to redo the operation?
Not usually for holes in the heart. If you get it right, usually you get it, you close the hole and it's a done deal. For narrowed valves, for the young lady that I did with a narrowed valve, they noticed the difference much, much faster, almost immediately. So again, it's a 24-hour procedure.
Is that because there's mixing of bad with good blood?
Not necessarily.
Sorry, not bad and good. Polluted and unpolluted.
It's usually more of the person has been living with not enough blood getting to a part of the body, usually the lungs. And the moment you open it up and more blood is able to get to the lungs, they notice the difference. When they exercise and when they do things, they notice immediately.
They're not breathless anymore, they have more strength.
Correct, and no chest pain, which is what she was complaining of. And she pretty much within 24, 48 hours, she said she already noticed the difference.
Oh, that's good.
That she wasn't getting any chest pain anymore and felt a lot better.
Cost implications.
Yes.
This procedure, which looks so wonderful and so short, how would you compare it to the traditional opening of the chest and, cost-wise?
Right. So these procedures, as you can tell, are quite complex. Whether you do it the normal traditional surgical way or you do it in the catheter laboratory like we do, are very complex procedures and, of course, usually a little bit expensive. The minimally invasive way that we do it in the catheter laboratory can be about the same cost as surgery.
Okay.
The main benefit is that rather than spending 7 days in hospital, you spend 1 day in hospital.
Okay, that's less bed space, less money for
you're spending on bed space. In addition to that, you're up and about the same day. You're back to work or back to school very, very quickly.
Back to work and back to school. Can that happen in 48 hours?
Back to school, usually they say you can go back to school within 3 days. For adults working, we say maybe a week off work and then you can go back to work.
Oh, that's,
and then also the main benefit, especially for ladies, is not having the scar coming down the chest, which obviously can be cosmetically a problem.
Do you do these procedures for people with, problems like Down syndrome?
Yes.
Problems like Marfan syndrome?
Absolutely.
I hear of
coarctation.
Coarctation, yes.
Correct.
It sounds so confusing, and I'm like, what will you do for somebody with Down syndrome who keeps coming up with one thing or the other?
So with Down syndrome children, we know that about 40% of Down syndrome children will have some form of congenital heart defect. It's actually quite common in them. So any parent who's listening or watching who has a child with Down syndrome, if they've not had their heart assessed, that is usually mandatory, that needs to happen. Usually the kinds of heart defects that Down syndrome children have usually requires open heart surgery. They can't always
They can't go through this new method?
Not all of them. Most of them will need surgery. A few of them may benefit from the minimally invasive technique. It's very important to select patients appropriately. But just because they have Down syndrome does not mean they should not have an operation. Okay. They absolutely deserve an operation. It will definitely improve their quality of life. The same with people with Marfan syndrome. Usually, again, they will require open heart surgery for the kinds of problems that they require. For coarctation, where you have a narrowing in the main blood vessel that supplies the body.
Okay, that's what coarctation is.
That's what coarctation is. It's a specific narrowing in a specific area in the big blood vessel called the aorta that supplies the entire body. That again can be treated just going through the leg. You put that
balloon thing.
You balloon it and then you put a stent there to keep it open. And again, that's a very straightforward procedure. Patient can go home the next day.
And life goes on.
Correct. And much better, in fact, because there's no symptoms anymore.
That's just great. Okay, how young can a child be for you to do this procedure? Is there a too young age?
So it depends on the procedure. For the kinds of procedures that we do, if it's for something like an ASD, for example, usually the guideline, you can do it on children as young as 2 to 3 years of age, but most people advocate that you only do it in children above 4, 5 years of age. But in terms of surgical procedures, there is really no limit. Some children, their conditions require that they have surgery on day one of life. So the day they are born, they need to have surgery. And, that's called neonatal surgery, and there are some specific conditions that needs to happen in. So,
how about how old the person?
Old, in terms of the procedures that we do, really just depends on how fit the person is. If the patient is relatively fit, there really isn't any age limit. And in fact, the studies have shown that when you do these types of procedures, the holes in the heart, sometimes you find them in 60-year-olds, 70-year-olds, and you still offer them closure, and you close it. And they actually derive the greatest symptomatic benefit from actually having it closed compared to someone who's younger.
At such an age.
That's correct. So just because someone is 60, 70 or so does not mean that they cannot have this procedure done.
Thank you so much for coming. That was
pleasure.
So enlightening. An operation through the leg. Wow. Thank you so much for coming.
Thank you.
Thanks for being there, and thanks for trying to call in. We'll do it again next time, next week. Have a wonderful day. I'm Mary Alale Yusuf.